Welcome everyone to our first ever virtual celebration of excellence for Muskoka Algonquin Healthcare. I am delighted to see so many staff and physicians join us virtually from their homes or their workstations across both sites so we can safely come together for a celebration of what is really core to this organization and all of our successes, our people. Tonight is about recognizing the incredible contributions and commitment of staff and physicians, our auxiliary volunteers and foundation partners, and our board of directors throughout the year, but perhaps more importantly, during some very challenging recent months. Tonight's program includes some special guests from our board and the announcement of the winners of the 13th Annual Board Award of Excellence. We have dubbed this event Showing Back. We all know the MAHC acronym well, but tonight I want you to think of it as showing my appreciation for healthcare. The COVID-19 pandemic has changed so much of what we do in every corner of the hospitals. Respiratory therapists and environmental services aides stepped up and adjusted their lives to accommodate a 24-hour-a-day, 7-day-a-week staffing model to support the COVID-19 need. Rehabilitation services embraced virtual technology and supported outpatients remotely for their physiotherapy needs. Urgent CTs and X-rays required two technologists for every patient encounter for enhanced infection prevention, one to operate the equipment and one to be with the patient, and staffing had to be doubled on the weekends. Imaging team members who were redeployed made strides in purging thousands of imaging films that no longer had to be stored under health information retention rules. Social workers made daily visits to inpatients to decrease the effects of social isolation during our visitor restrictions. Robust surge operational plans were developed collaboratively and quickly. On multiple occasions, quick efforts by many, including bed allocators, patient flow navigators, nursing, and others, to move patients, create isolation areas, and open surge units on the fly to respond to occupancy challenges. Clinical educators and physicians supported corporate learning needs around protected code blue, urgent intubation in the emergency departments, and developing the process, protocol, and education for proning or turning a ventilated patient in the ICU. Staff whose role was impacted by service reductions were temporarily redeployed to support other areas like occupational health, infection prevention and control, our inpatient units, and screening of staff and the public entering the buildings. Environmental services aides enhanced cleaning, and because of suspect COVID, spent anywhere from up to 90 minutes cleaning a patient space in the emergency department and up to 2 hours for an inpatient room, depending on the size of the room and the equipment used. Global competition for supplies, most of which are manufactured in China, forced purchasing to explore non-traditional procurement avenues and make quick decisions to secure goods. Amid the additional preparations and precautions, many hospital services continued. These statistics help highlight the activity at both sites over a 12-week period after the pandemic was declared. Some of these numbers are lower than normal activity, but it is so important to appreciate this care was provided during an active pandemic and required many changes in practices to keep everyone safe. While emergency department visits dropped by nearly half for a period of time, the acuity was high. 65% of these visits were urgent, emergent, or resuscitation visits. We continued to provide diagnostic imaging for urgent needs with more than 10,000 exams over the 12-week period. We also delivered babies, and in fact, over the Easter weekend alone, there were 6 deliveries. Looking forward, as the province of Ontario takes steps to reopen the economy, we are also preparing plans for a gradual and cautious reopening process. Once again, we will come together as a team to create the best plan for resuming services, recognizing that things will be different for years to come. This is an opportunity for hospitals to redesign how we provide care in the future to reduce safety, risks, and embrace virtual care and remain ready to respond to unexpected COVID-19 surges. Our top priority is to make sure everyone will be safe when they return to the hospitals, and this includes making more changes that will protect against the spread of the virus, like respecting the ongoing need for physical distancing and other public health measures. We must remember that the pandemic continues, and we will coexist with COVID-19 until a vaccine is available. That strict infection control and safety precautions will continue for some time, and there will be a new normal for all of us. Resuming services will not happen with the flip of a switch. It will take weeks, not days, and as you can imagine, just like the rest of the world, hospital operations will look very different as we move forward. And as I mentioned that old cliche earlier, it will still take a village. But let me tell you, the village that I would put my money on is Muskoka Algonquin Healthcare. Make no mistake about it, every single one of you have made an impact and contributed to our success. Every single one of you deserves a round of applause. Every single one of you should be so proud. As we forge forward in these uncertain times, always remember that you are not alone and that together we can and we will get through this together as Team MAHC. And now, to help us all reflect, we have a short video to look back at the past few months.
Wow, watching that video really paints a picture of life at MAHC over the last few months and all of your exceptional efforts. Good evening. My name is Cameron Renwick, and I'm honored to be the incoming chair of the Muskoka Algonquin Healthcare Board of Directors. Throughout the pandemic, the board has kept up to date and actually moved to virtual board meetings. I know I speak for all of my directors when I offer my heartfelt thanks to all of you for enduring these most trying times. We are so impressed and humbled, and it's clear from the overwhelming community support that your commendable efforts are recognized throughout our region. We are so very fortunate to be in Muskoka. Tonight truly is a celebration of excellence, and I'm excited for the Board Award of Excellence presentation that's coming up next. On behalf of the board, congratulations to all the nominees, and my best wishes to all to stay safe and well, take care of yourselves, and keep up the excellent work you've become known for. Before my board colleague Brenda Jafusha joins us for the board award presentation, I want to take a few moments to share some remarks about my predecessor, Mr. Phil Matthews, who retired from the MAHC board earlier this month after nearly a decade of volunteer service. Phil became a board director in 2011 and served on several committees before taking the helm as chair in 2018. Over the years, he's been critical to strategic planning and the planning for the future, including an immense involvement in the work to transform the local healthcare system. As you can see in the comments that we have collected from his board colleagues, Phil is well regarded as a steadfast leader and a devoted advocate for MAHC. He is a role model, setting the best example for others, and a dedicated chair who set the bar very high. Phil's contribution to Muskoka Algonquin Healthcare are also commended and celebrated. It's been my privilege over the past 7 years to serve with him and to learn from him. Those of you who know Phil and I both, we both love bagpipes and fine scotch. So to pay tribute to my mentor and to say goodbye in style, I'd like to leave Phil with these final words.
Well, Phil, congratulations. You made it to your final meeting. Do you feel like this has been a long time coming? Hopefully not. You might be wondering why I'm dressed the way I am. Well, let's just say that your inspiration for, oh, the board should eat some haggis, really got on my mind. And so 2 or 3 months ago now, I approached Tammy and Natalie and said, hey, wouldn't it be fun if we all had a Scottish meal, complete with haggis? I'd pipe it in, and we'd even do an address at the beginning of the board meeting. We were all set to go, and COVID-19 got in the way. So I'm dressed up today as I would be. Don't have my pipes with me. I do have 5 pounds of haggis that's ready for you though. And I guess we'll have to just save that for our next Robbie Burns on January the 25th, 2021. Hopefully by that point, things will have settled down. With our band, at really special occasions, we have a toast. And so I would like to propose that toast to you. I've got a crystal glass of single malt here, and I wanted to make this to a fantastic man, a fantastic board chair. It goes like this. May the best you've ever had be the worst you'll ever see. May a moose nail your pantry with a teardrop in its ee. May your lum keep reeking blithely till you're old enough to dee. May your A be just as happy as I wish you to be. Slanja. To Phil, fantastic chair, great friend, terrific leader. All the best in your retirement from MAHC.
Nicely done, Cameron, and my heartfelt thanks to Phil for his tremendous contributions to MAHC. Good evening. My name is Brenda Jafusha, and I've had the pleasure of serving on MAHC's Board of Directors for the past 6 years. Since January of 2016, I've also served as the Treasurer and Chair of the Resources and Audit Committee of the Board. One of the great opportunities that comes with being the chair of this committee is that I'm asked to present the annual Board Award of Excellence to very deserving winners. This year, with social and physical distancing, we have this new virtual way of recognizing the hard work and dedication of the people of MAHC. The Board Award of Excellence program is a peer-nominated award designed to provide the board with an opportunity to recognize and honor the outstanding performance and achievements of staff and physicians within our hospitals. Congratulations to all of this year's nominees. What an honor to be recognized by your peers and colleagues for the work you do every day. And now it is my distinct pleasure to announce this year's winners of the Board Award of Excellence. The first recipient is an individual who has made significant contributions to promote and exemplify MAHC's organizational culture, which celebrates our values of accountability, respect, optimism, leadership, and engagement. She is described as a role model and a consummate professional going above and beyond to help and make herself available to support the organization and our people. Her willingness to jump into a number of roles and to help in other departments is always to be commended. She is a strong patient advocate, providing care that is always patient-centered. Most times, you get a hug if she sees that you need one, pre-COVID of course, always followed up with her by her asking, "What do you need?" Congratulations, Ruth Shaw, registered nurse in the ICU. Your dedication to the people and patients of MAHC has been recognized by your peers and the MAHC Board of Directors. The second Board Award of Excellence goes to an individual who took on an interim role to manage infection prevention and control in addition to her regular management role. Shortly afterward, the global pandemic occurred and our whole world was focused on keeping our patients, community, and staff safe. IPAC is at the center of ensuring protocols are in place based on best practice and best evidence. Leading a small team of infection control practitioners and executing her duties on the Incident Management Command team, she has worked tirelessly and risen to the occasion. Her calm, clear, and consistent style of leadership makes Ellen Stillwell the next deserving recipient of the Board Award of Excellence. Congratulations, Ellen. The third recipient is a physician who makes MAHC a better place with his commitment to outstanding patient care and the kindness and respect he shows to others. From bringing coffee in during night shift for staff, despite having worked long, hard hours himself, to his daily friendly greetings and ever-present smile, he always has time for others. It is very evident that he supports, respects, and values staff in all positions. He lives the patient and family-centered care philosophy, and he goes above and beyond to ensure clinical coverage for our services continues. His leadership has been a welcome addition to Muskoka Algonquin Healthcare. Congratulations, Dr. Khaled Salem, our Chief of Internal Medicine. And finally, the fourth Board Award of Excellence goes to someone who has been instrumental in the planning and organization of the most recent MAHC Christmas party. She handled both behind-the-scenes activities as well as some during the party, which contributed greatly to its huge success. In fact, she developed a process that can be used in future years. In addition to this social event planning, which can be equated to planning a wedding every year, she consistently goes the extra mile in her interactions with our patients and families who come into the business office. Always polite, respectful, and ensuring their needs are met. She is also renowned for her seasonal decorating of the office. Her themes are always something our teams look forward to seeing. Her personal touch makes quite an impact on the working lives of others in the organization. That is why the final Board Award of Excellence is being presented tonight to Sandy Harris, Accounting Clerk. This concludes the 2020 Board Award of Excellence presentation. I would like to give one final congratulations, not only to our 4 winners, but to all those who were nominated. Stay safe and all the best.
Thank you, Brenda. The Board Award of Excellence presentation is certainly one of the highlights I look forward to every year, and I am so grateful that we could still come together for this celebration. As tonight's event, Showing MAHC, is brought to a close, I would ask that you all give each other a virtual pat on the back. And please just know how valued and appreciated all of you are. On behalf of Muskoka Algonquin Healthcare, our sincerest thanks for all that you do. Good night, everyone.